everyone. Kia ora. My name is Jebin Akhtar Himu, and today I will be presenting my Tableau storyboard titled, which is Uncovering Key Risk Factors of Lung Cancer, a socio-economic and environmental perspective. This analysis is based on a dataset from Kaggle and it was completed for the BSNS 8031 Analytics Storytelling course at Unitec. Let's explore what the data reveals. Lung cancer remains one of the most common and deadliest forms of cancer globally. My analysis aims to explore the main research question, and my main research question is, what are the key socio-economic and environmental factors influencing lung cancer risk and survival probability in different demographic groups? And to address this, I created four sub research questions. First one, how do smoking status and second-hand smoke exposure affect lung cancer predictions and mortality risk? And the second one, what role do socio-economic status and healthcare access play in early diagnosis and survival? And the third one, is there a difference in diagnosis delay based on rural versus urban region? And the last one, how does air pollution exposure correlated with mortality risk? Now I am showing my Tableau screen. I think everyone see on my screen. Here I put my raw data set, which is lung cancer prediction, and there is all in independent variable like country, age, gender, smoking status, all of this. Now I'm showing my first visualization, which is smoking status versus lung cancer prediction. First, we look at smoking related behavior. In this bar chart, I compare lung cancer prediction rates across the three groups. First one, former smoker, second one, non smoker, and the last one, smoker. As expected, current smoker have the highest prediction rate. In the dataset, over 72% of smokers, that means 30,757, were predicted as likely to have lung cancer. For former smoker, the prediction was still high, around 58%. That means 30,585. What stands out that is that non-smoker exposed to second-hand smoke had higher prediction rates than non-smoker without exposure. This reinforces that second-hand smoke is not harmless; it's a real risk factor for lung cancer. Now I'm showing my second visualization, which is socio-economic status and healthcare access. This heat map visual look at survival probability in relation to two key social factors. First one, socio-economic status, and second one, healthcare access. We notice that people with low income, that means poor, and low income and poor access, that means these have the lowest 5-year survival probabilities, averaging around 32%. That means 0.499600 average survival probability. Also we can see there is socioeconomic high and healthcare access good. Their step point is average survival probability rate is 0.499505, and which is percentage is 0.78, that means 78%. This large difference highlights the critical role of inequality in cancer outcomes. Even if two people have the same disease, access to early treatment, insurance, and follow up care makes a major difference in within they survive. Now I'm showing my third visualization, which is diagnosis delay by region, rural versus urban. Next, location factor using a box plot to compare diagnosis delay between rural versus urban patients. The dataset reveals that diagnosis delay is more common in rural areas, with the delays reported is about 64% of rural patients, which is 138,104, and compared to 38% urban patients, that means 2,30,000, 146. This suggests rural residents may face challenges like limited screening availability, long travel distance, or health literacy barriers. Early detection is critical for successful treatment, so improving healthcare infrastructure in rural areas could help reduce late stage diagnosis. Now I am showing my last visualization, which is air pollution exposure versus mortality risk. The trend shows that as pollution exposure moves low to high, the average mortality risk increase from low is zero point 0.2 and high is 0.65. There, every country have how much their air pollution high, low, and medium and mortality risk. Like in high country name is Bangladesh, and their mortality risk is 1,552. This is full line of high mortality risk country. And now I'm showing my low mortality risk country like USA, Thailand, Tanzania, South Africa, Russia, Japan, Italy. Now I'm showing my medium air pollution and mortality risk country, which is Turkey, Thailand, Tanzania, South Korea, etc. All of this country, when I put this show country name, air pollution, high, medium or low, and mortality risk number also. Now I'm showing my dashboard. I combine these four risk categories into a summary dashboard. It shows how different dimensions, behavior, income, location, and environment interact and intensify risk. The pie chart highlight that smokers made up over 50% of lung cancer positive predictions, and patients with both low income and pollution exposure had the lowest survival outlook. This summary helps health profession and policymaker identify the most vulnerable populations and act quickly to support them. Now I'm showing what actually I find my some key findings on my visualization. First one, smoking and second-hand smoke remain the leading cause of lung cancer. And second one, socio-economic factors, especially income and access to care, significantly impact survival. And the third one, rural residents face more delay in diagnosis, increase their risk of advanced cancer stage. And the last one, air pollution and occupational exposure greatly increase the mortality risk. These findings clearly show that lung cancer is not just a health issue, it's also a social justice and environmental problem. Now I'm discuss about my some recommendations based on these findings. First one, stronger anti-smoking campaigns, especially in low income and high risk communities. Public health and should target both smoking and second hand exposure. Second one, improve healthcare infrastructure and rural areas with mobile screening vans, tilted and better diagnosis system. And the third one, run awareness program in school, factories, and rural clinics to help people understand early symptoms and seek help. And the last one is introduce or enforce air quality laws in industrial zones, provide proactive measures for workers in hazardous jobs. These steps can save lives, reduce the treatment burden, and make the system more equitable. Now I'm talking about my conclusion. My Tableau analysis shows that lung cancer outcomes and shaped by combination of lifestyle, social and environmental risk. People living in disadvantage areas are not only more likely to get cancer but also less likely to survive it due to late diagnosis and poor care access. If we want to reduce cancer death, we need to solutions that address behavioral risk, environmental health, and social inequality together. That's the power of data storytelling. We can uncover the patterns and build better system from them. Thank you for watching my presentation. I hope this analysis has shown how data storytelling can support public health decision making. If you have any question or feedback, I would be happy to discuss more. Once again, I am Jevin Akhtar Himu. Thank you for your time and attention.